Hello everyone, thank you to be here. I'm Belgium Depoorter, I'm physical therapist at Depoorter Institute in the Hematology Service. I will speak you about the physical training during the treatment. We will see the most frequent complications about AL amyloidosis, and we will see where the physiotherapist or physical therapist can have an impact on your quality of life. So we begin with the cardiac complications with an incidence of 60%. It's an important prognostic factor that can lead to an increase of myocardial stiffness and conduction troubles. Some symptoms are, for example, asthenia, dyspnea, and fatigue. And what can we do in physiotherapy? Of course, adapted physical activity. Adapted for me is very important because I prefer that you do this with a physiotherapist or physical therapist instead of a sportive coach, because the physiotherapist is formed to adapt the physical activity to your disease, contrary to a sportive coach. And the literature have shown that physical activity can decrease the myocardial stiffness, reduce the mortality, improve the quality of life, the cardiac function, and the exercise capacity. The loss of muscle mass is not rare in AL amyloidosis, and it's multifactorial. It's due to the deconditioning of the disease and the side effects of the treatment. The loss of weight, the corticoids will increase the catabolism of the proteins, the polyneuropathic pain, and arthralgias. And so if you do adapted physical activity, you will increase your muscle mass and so be stronger to support the treatment. And the polyneuropathic pain and arthralgia, it's a vicious circle because patients have pain, so they don't want to move, so they lose muscle mass, etc., and so it's a vicious circle. The neural complications with an incidence of 20% that can lead to sensory motor troubles like tingling, numbness, loss of sensitivity, etc. That can lead, of course, to polyneuropathic pains, also due to the bortezomib, with an important treatment in the AL amyloidosis, the carpal tunnel syndrome, and the dysautonomia, with an orthostatic hypotension and digestive trouble, with a T is better for digestive. For the neural complication, what can we do in physiotherapy? First, of course, again, the physical activity. The literature have shown that can reduce the symptoms of the polyneuropathic pain, but has no preventive effects. If the polyneuropathic pain have to come, they will come, but maybe lower than without physical activity. And the literature recommend to walk a lot. The neural stretching and gliding are techniques in physiotherapy who can help the nerve of sliding in the limb and stretch the nerve. That can reduce the symptoms and reduce the piece of substance who is a neurotransmitter of the pain. Abdominal massage that can help for the constipation, that reduce the symptoms, the defecation difficulties, and the quality, and that improve the quality of life. My message here is that the physiotherapist can stimulate you for the physical activity and guide you, but also it's very important that the physiotherapist teach you this technique like neural stretching and abdominal massage to do it at home during your daily life. I have a patient who has polyneuropathic pain. She has multiple myeloma and treated by bortezomib, and she's a hairdresser, and she has a lot of polyneuropathic pain in the feet, and so it was very difficult to work 8 hours per day. And so I teach her the neural stretching. And so she does it during his work, and when the pain is too intense, she gives the other client to a colleague, and she go to another room. She do the stretching during 2 or 3 minutes, and after that help her for 2 or 3 hours. but so she can work with a decrease of pain for 2 or 3 hours. And so that's important to have a key in your daily life. Maybe that would help you for 10%, 30%, 50%, I don't know, but it's proved that when we have a key to reduce the pain or avoid the pain, we support better the pain than if we just don't know what to do or just see and crying. So yeah. The physiotherapist can help you too for the orthostatic hypotension and give you advices for the transfers to stimulate you again for the physical activity, and to wear class 2 support stocking. Class 2 support stocking can help you for the edema too, and he can teach you emergency maneuvers to quickly, when you have the first symptoms of an hypertension, to quickly increase the arterial tension, like pressing a ball, like doing this exercise, etc. For the pulmonary and articulary complications, for the lungs, for example, there are restrictive syndromes in the AL amyloidosis due to the reduction of the lungs volumes and the compliance of the thoracic cage. And so it's a risk factor for atelectasis, and that can lead to pulmonary infections. And so the adapted physical activity and the respiratory exercises are very important to reduce the risk of restrictive syndrome. For the articulations, all the physiotherapist techniques like muscle strengthening, stretching, aerobic exercises can reduce the pain of the arthralgias. So in conclusion, the physical therapist can have an impact on your cardiac health, your pulmonary function, your neural symptoms, and the pain. And so that can help you for your quality of life and your fitness. And so for me, it's important also for the pain, because we know that AL amyloidosis patients have a lot of medications. So if the physiotherapy can help you to reduce the pain for, again, 10, 30, 50%, maybe you will take less opioids or less analgesic drugs, and that can preserve your liver and your kidneys. So I think it's a good advice. And so after that, you will be better, stronger to support the treatment, to go to the end of the treatment, and maybe the hematologist will not have to stop the treatment or to reduce the drug, and that give you more chance against the disease. Thank you very much for your attention.